So we're going to discuss the skeletal anatomy relevant to cervical facet joints and the cervical facet joint medial branches and the third occipital nerve. So first thing to highlight is when we use the ultrasound guidance, we always position the ultrasound probe on the tip of the mastoid process in order to look for the sternocleidomastoid muscle. After that, we go about half a centimeter to a centimeter posteriorly, and then the first joint that you would see on the ultrasound guidance will be your C2 and C3 joint, because the C1, the atlas, has a very thin bony rim and you might not be able to locate this on the ultrasound. So the first joint that will be visible on the ultrasound image will be your C2, C3 joint, and the C2, C3 joint is supplied by the third occipital nerve, which is located on the top of the C2, C3 joint, and it's a monofascicular nerve where you will be able to see it like a black dot on the ultrasound image. Followed by this, every medial branch, corresponding medial branch, is located in the cervical facet joint column, and we call this as a valley, and where you see C3 medial branch located here, C4 medial branch located here, C5 medial branch located here. In regards to C6 and C7, the medial branches, instead of locating into the cervical facet joint column, they are basically located more towards the top of the facet joint rather than at the bottom. So when you use ultrasound guidance to perform this medial branch blocks, there are two ways you could do it. You could do an out of plane technique, and when we perform the out of plane technique, the aim is to bring the needle from anterior to posterior. So this is a clinical tip, because if you bring the needle from posterior to anterior, you will be targeting all the important vital structures like vertebral artery, carotid artery, cervical nerve roots, and cervical spinal cord, and you don't want to damage any of these vital structures. Hence, the recommendations are, when you use an out of plane technique, bring the needle out of plane from anterior to posterior. Just in case if you miss the bony column, you still will be safe, because your needle will be placed in the posterior vertebral muscles and you will not injure any important structures. Another way to do the medial branch blocks or the facet joint injections would be to do an in-plane technique using a transverse view, where you can bring the needle from posterior to anterior. You'll be able to see the needle tip, and you will be putting your needle here to block the third occipital nerve, and this will be the C3 medial branch block, this will be the C4 medial branch block. So essentially the needle tip will be visualized throughout. If you want to perform the facet joint injection, when you're moving the ultrasound probe chordad, you will see a gap between the two bony landmarks, and you will be able to target the facet joint using an in-plane technique. Thank you.